Hello, I'm Ginny Brant with Unleash Your God-Given Healing. And today we're going to look at 15 questions you might want to ask your oncologist. Are you ready? Number 1, what percentage of patients have you cured with the chemo regimen recommended for me? This is important to know because if the rate of cure is very, very low, you might want to get a second opinion about another chemo regimen at a specialty cancer center. Number 2, does your hospital offer genetic and genomic testing? Genetic testing is when they, from a blood sample, see what genetic factors you have for the specific cancer that you've been diagnosed with. This is important to know because in many cases, it can determine things like your surgery. In a breast cancer case, the surgery is going to be more complete if they know you have the BRCA1 or BRCA2 gene. Genomic testing is when they test your cancer cells against all the chemical adjuvants to find out which ones work best with your body and your cancer. An important thing to know if it's offered. Number 3, if the side effects are too much for me from my chemo, are you willing to reduce the chemo amount? Now, why is this important? Many oncologists are very reasonable and realize they can only give you what your body can handle. If you happen to have an oncologist who loves to give you as many chemicals and as much dosage as possible, and they think that's the best way, and personally, I did not want that route, then you're not going to jive with that oncologist, and you might need to look for another oncologist. Remember, you're in the driver's seat. Number 4, can you refer me to a nutritionist who specializes in cancer that can teach me how to keep my immune system up and strong during chemotherapy? There's lots of things that the power of nutrition can do to help you to get through chemotherapy by properly nourishing your gut and eating cancer-fighting foods during chemotherapy. So ask. Number 5, how will I know if the chemotherapy is working? Can you order an ultrasound, a test, or a scan after 2 to 3 rounds so that I can know it's working? Now, why is this important? Most oncologists are going to, at least by 3 or 4 rounds of chemo, do something to check. Some wait until all 6 rounds have been completed. But it's important to know as soon as possible, when it's feasible, whether the chemo is working or not. Because after 3 or 4 scans, if it's not working, it's time to drop back, stop that chemo, and then you'll have to begin with new chemicals. And the sooner you find that out, the better. Number 6, what are the risk factors for the cancer I've been diagnosed with? This is very important to know. My mother's oncologist was able to tell her immediately, you have a major risk factor for this cancer. You were taking artificial estrogen hormones after menopause for 32 years. This helped to drive your cancer. You must stop immediately. In my case, the doctors looked over the 8 risk factors for my cancer. I didn't have one of them, which caused me to look deeper. Number 7, are you willing to occasionally test my vitamin D levels on a yearly basis so I can keep them to optimal during and after treatments? Knowing your vitamin D levels, mine was like 26 before I was diagnosed. My doctors wanted me to get up to 70 to 90. I am now holding between 80 and 90. And the fact that they're ordering this test on a yearly basis is helping me to do that without allowing them to get too high. A great way to help your own immune system to fight cancer. Question number 8. will this chemotherapy reduce my bone density? And if so, can you refer me to a physical therapist for exercises to help me hold my bone density? This is important to know. A lot of chemotherapies reduce your bone density, and in women, this can be a real issue. When my oncologist made a referral to me to a PT therapist, I was able to do exercises. It was hard work, but it helped me to hold my bone density. Question number 9. Do you think that exposure to toxins has anything to do with my cancer? Big question. I didn't ask this question, but I discovered it on my own. In doing research for other cancer patients on great websites like the Mayo Clinic and Harvard Health and Cleveland Clinic, you will find that they will list risk factors, and many times they're starting to list certain toxic chemicals related to many cancer diagnoses. So this is important to know because you're going to want to stay away from these toxic chemicals. Number 10, is my treatment curative or is it palliative? This is important because if they tell you we can only extend your life for a year or two, then you have an important decision to make. Do I want to go through all these treatments, all the pain, all the suffering, knowing that it's just extending my life and it's not going to be cured? Depending on how many weeks or months you may have left, you may decide to die a natural death. These are personal decisions that only you can make, or you may decide, if I could live just a few more years and see my grandchildren born and I have a few more things I want to do in life, then you could choose to go through the treatments. It's a personal decision. Number 11, what percentage of patients have their cancer return after these treatments? If you get a low number here, then you're going to feel a lot more comfortable. If they tell you, as they told me, your aggressive cancer after these treatments has a high rate of return and you're not promised tomorrow, then all the more reason to implement lifestyle changes during and after chemotherapy. How about this one? Number 12. If I were your mother or father, would you recommend this chemo regimen at my age of 78, 80, 82, 85? You might be surprised to learn that most oncologists wouldn't when you put it in that perspective. Number 13. I'd like to try water fasting to extend my own autophagy, where my own body kills cancer cells. If I do this, would you be willing to reduce the amount of chemotherapy? One of the things I learned from Dr. Robert Elliott, the doctor who wrote parts of my book for me and was so valuable in my journey, was that if you lower your blood sugar, if you lower the carbs in your diet, if you even water fast, you can actually extend your own autophagy and make the kill rate of the chemo better with less chemicals. So ask. Number 14, is the risk of side effects of my chemo worth the benefit to me? Only you can answer this question, but you need to ask so you'll know much more about it. For example, let's say that your doctor cleared your margins, got the cancer tumor with surgery, and one lymph node shows some cancer. Here's the question, doctor. Is it worth my going through 4 to 6 rounds of chemotherapy when technically you removed that lymph node and I'm kind of cancer-free? Can I lessen the rounds of chemotherapy? Can I opt to go without chemotherapy in this situation? It never hurts to ask. And number 15, you might be surprised at the answer to this question. Does your cancer center have an anti-cancer lifestyle program or cancer prevention and wellness center that I can be a part of to help me to change my lifestyle and do better in the cancer journey. Believe it or not, MD Anderson has one, Cleveland Clinic has one, Johns Hopkins has one. Around the country, these are being added to cancer centers. Of all things, Greenville Hospital System, Prisma, just an hour from me, now has a cancer prevention and wellness center that you can be a part of for free by joining their research program. These are very helpful things to know, and you can have experts to give you wonderful advice to improve your prognosis. I hope these 15 questions have given you very helpful information so that you can do better through chemotherapy by being your own best advocate and asking important questions. Please subscribe to my YouTube channel at Ginny Brant, like this video, share it, and ask to be notified when I make new videos. Here's to your health, especially in the cancer journey. Thanks, and God bless.